Airports across Asia are back on high alert after a virus with a 75% death rate just infected healthcare workers in West Bengal. It causes brain swelling and respiratory failure, and right now, there is zero vaccine and zero cure. Here's exactly how the 2026 Nipah outbreak started, and the one sign you need to watch for that doctors are calling a priority threat. Before we dive into the data that could save lives, please take a second to like this video, subscribe to the channel, and share this with anyone you know traveling in South or Southeast Asia. Staying informed is our first line of defense. The Barasat incident. The crisis we are witnessing today began quietly in late December 2025. In the city of Barasat, North 24 Parganas, two young healthcare workers, a female nurse and a male nurse, both aged 25, began complaining of persistent high fevers and severe muscle pain. Working in a busy private hospital, they initially thought it was a seasonal flu, but within days, their condition took a terrifying turn. By early January 2026, both were hospitalized with rapidly deteriorating neurological symptoms. They weren't just sick, they were losing consciousness. On January 11th, the Viral Research and Diagnostic Laboratory in Kalyani flagged a suspected Nipah infection. 2 days later, on January 13th, the National Institute of Virology in Pune confirmed the nightmare. Both had tested positive for the Nipah virus via RT-PCR and ELISA testing. This was a massive shock to the system. West Bengal hadn't seen a Nipah case since 2007. The sudden reappearance of this pathogen of global concern in a clinical setting meant that something had shifted in the local ecosystem. What is the Nipah virus exactly? To understand the danger, we have to look at its origin. Nipah is a zoonotic paramyxovirus. Its natural home is inside the Terapis fruit bat, also known as the flying fox. These bats carry the virus for life without ever getting sick. But for humans, it is one of the deadliest substances on Earth. The virus typically spills over when humans consume food contaminated by bat saliva or urine. In this 2026 outbreak, investigators are looking closely at raw date palm sap and fallen fruits. In West Bengal and neighboring Bangladesh, the winter season is date palm harvesting time. When bats lick the sap being collected in open pots, they leave behind a viral load that can survive for days. But there's a darker side to this virus, human-to-human transmission. While Nipah doesn't spread as easily as a cold, it is highly efficient in close contact environments. This is why the infection of two nurses in Barasat sent a chill through the medical community. It suggests that even with standard hospital precautions, the virus found a way to jump from a patient to the very people trying to save them. Once the Nipah virus enters the human body, it doesn't just sit in the lungs, it is a multi-organ predator. Dr. Deep Das, a leading neurologist, explains that the virus creates systemic inflammation in the blood vessels. This inflammation allows the virus to do something truly horrific. It crosses the blood-brain barrier. This is what doctors call acute encephalitis. The brain begins to swell inside the skull. As the pressure increases, the patient enters a state of altered consciousness. They become dizzy, then drowsy, and then confused. If the swelling continues, it leads to uncontrolled seizures and a coma within 24 to 48 hours. Simultaneously, the virus attacks the respiratory system. It can cause atypical pneumonia, where the lungs fill with fluid, leading to acute respiratory distress syndrome. Imagine trying to breathe while your brain is losing the ability to tell your heart to beat. That is the reality for 75% of those who do not survive. As of early February 2026, the world is reacting. Despite the Indian government's statement that the outbreak in West Bengal is contained after testing 196 contacts, neighboring nations are not taking chances. Pakistan has introduced mandatory thermal screening at all points of entry. Thailand and Singapore have issued travel advisories, and Malaysia, the site of the very first Nipah outbreak in 1998, has ramped up its biosafety protocols at international airports. Even the CDC in the United States is monitoring the situation, as the ease of international travel means a 14-day incubation period is more than enough time for a silent carrier to cross the globe. The priority threat sign that every traveler and healthcare worker must know is the onset of neurological confusion paired with a respiratory cough. If a fever is followed by a loss of balance or disorientation, it is no longer a flu. It is a medical emergency. The tragedy of Nipah doesn't always end with death. For the 25% to 60% who survive, the battle is far from over. Approximately 1 in 5 survivors are left with permanent neurological damage. This includes chronic seizures, facial paralysis, and significant personality changes. In some rare, terrifying cases, the virus can even reactivate. Years after a person thinks they are cured, the virus, which has been hiding in the nervous system, can wake up and cause a fatal relapse. This is why the WHO has placed Nipah on the same priority list as Ebola and Zika. As we move through 2026, deforestation and climate change are pushing fruit bats closer to our cities and our farms. The spillover events we are seeing in West Bengal are a warning. We must stop consuming raw date palm juice. We must wash and peel every piece of fruit, and we must respect the boundaries of wildlife. There is no vaccine yet, but human knowledge is our best shield. If you found this deep dive helpful, please check out my other video on the rabies virus, the only pathogen with a fatality rate even higher than Nipah. Stay vigilant, keep your family safe, and I will see you in the next update.